So we're a general practice, a GP surgery. We serve the general public. We have 11,000 patients across 2 sites based in the Derby location. The main site based here in Chaddeston, and we've got a site down the road in Spondon. So before Ethos came along, we had, again, we've got the 2 practices. The patients were ringing the practice for an appointment or for the results. The patients increased in complaints because they were getting an engaged tone, telling us that they was ringing the practice between 50 and 100 times to get an appointment. So we needed to do something better for the patient service. So we looked at several companies to host our telephony service. Ethos stood out to us due to its functionalities that it had in place. It was great to be able to get through to different offices in the building. So for example, if I need to ring the other practice and go straight through to a clinician, I can go through there instead of have to put through to receptionists and put on hold. Therefore it's time efficient for us. It stood out for its reporting side of things, so we'll be able to see on a daily basis how many calls are waiting on the call board. We can see how long it's taken for the receptionist to answer the patients, so we can look at statistics and analyse the data in the practice to run the business more efficiently. What's great about the Ethos Telephony Solution is continuity of care for the practice and patients. So for example, if the server went down at one of our sites, we can direct the calls straight to the other site, meaning patients don't get affected for their care and they can still get through to the practice. The patients now can phone through and they get put into a queuing service. I like the fact that it's got an overflow service, so because we have the 2 sites, if one site is busy, the calls will automatically flow to the other practice, enabling patients to get through to the surgeries a lot quicker. We also can do reporting on the system, so we can look at what times of day is high demanded by the patients, so we can give them more staffing. On the day I was a little bit nervous. I was rest assured by Ethos and the engineers. It was really friendly, helpful. They came in and trained the staff before the telephone system was put in. We had no disturbance at all to the practice. The phone lines went over very smoothly. Patients will still be able to get through on the phones. Really, really amazing on the day of how smooth the transition was over from one service to the other. The help desk is fantastic. You can call one dedicated number and then someone answers really promptly. So in primary care, we have to be forward thinking with the current situation. Ethos has helped us to look at our staffing levels and where we need to prioritise for the patients. The support that's been given by Ethos has been great. I definitely recommend Ethos to other GP practices.
Gemma contacted us with a number of challenges, I guess, as a medical practice, as a multi-site medical practice. The first concern was business continuity. What happens if one site goes down, whether it's adverse weather or a power outage? How will those calls be handled? So one of the first things that we had to look at was making sure that if that happened, calls, traffic would automatically be diverted to the secondary site. It was also quite important that if that happened, the receptionists at this end knew that the call was coming from the other site, so they could answer it appropriately. So that was an interesting challenge, and we managed to implement that. Having the control, the wallboard, the call reporting, having a better understanding of how many calls were coming into the practice, how quickly they were being answered. Obviously NHS look very closely at the way that their medical practices perform in terms of making sure that patients are able to book appointments. So that was something we put a lot of time and effort into making sure that we implemented, so Gemma had the control that she needed. The other critical factors were the overflow. So if there's a large influx of calls going into one particular practice, you know, how do we manage that overflow? So we got to a point where we were able to get those calls coming through to the secondary practice, and again, you know, the receptionist knowing where that call was coming from. And finally, it goes without saying, support was a huge factor for this medical practice. If there are problems, if there's downtime, if there are billing queries, ongoing training in particular was very important for Gemma and the team. Is there a number they can call, and does somebody respond quickly? And I think that from the feedback that I've had from Gemma when we've done the post-installation review, we've managed to get all that right. So for me as a consultant, if you like, it's been very satisfying to see the whole thing come together, and for Gemma to see the results, and ultimately for patients to get the service that they require. So, you know, on the whole, very, very good project.